Okay, 31st of September 2025. This is the case. One of my students got it yesterday. So it says nappy rash. This is where people get wrong with recalls. The case was a child presented with a rash, and after the doctor took history, he came to a diagnosis. It is in the nappy region, so it's a nappy rash. Then the scenario says ask the examiner for findings. Then when you ask the examiner for findings, the examiner is going to give you an image and you have to describe the image. In other words, describe the rash to the examiner. Then at the end, you have to explain the diagnosis to the mother. So this is where a lot of doctors make mistake, is they think it's a case of nappy rash. Unfortunately, if you think like that, most likely you will fail the exam. So this is where I teach in my courses and the group coaching program about the A, B, C, D, E approach, where you actually think in a systematic or a step-by-step manner. This case is actually a child with a rash. That is the whole scenario. A child presented to you with a rash. And when you read a scenario like this, ask what are the action words, what are the blunders, what are the common diagnoses, what is direction. Then you enter the room with a smile. So this is how you need to approach. You need to ask yourself what will kill this child with the rash, which is the blunders, and what are the common causes. Okay, so if you just jump on a diagnosis of nappy rash, you will probably miss the diagnosis of meningitis, and that is what will fail you. Many doctors fail purely because they don't have a structured approach, and they don't go in a systematic manner, and they don't behave like a safe doctor. Everyone knows a rash in the nappy region is a nappy rash, but why are most of the doctors failing and only some doctors passing? That's because the doctors who pass have a approach, and which is what I teach in my courses. And this case is, you need to think like it's a case of a rash in a child. Then you ask the examiner for findings. When you ask the examiner for findings, you have to ask about examination findings of a rash, not just nappy rash. Okay, you need to rule out CNS red flags. Then the examiner is going to give you an image, and you have to describe the image to the examiner, which means you have to describe the rash. Then you need to explain the diagnosis to the mother. So here you can't use any jargon. When you talk to the mother, no jargon. But when you talk to the examiner, you can explain that there is a maculopapular rash, because that is, you're talking to an examiner, so you can use jargon there. So that is very, very important. When you talk to the examiner, he is a colleague, he is a doctor like you can use jargon. But where people fail, this is the easiest case, is because they don't have that structured approach, they don't have that systematic approach, they don't have the frameworks. So that is what you need to do. You need to ask yourself what will kill this child with this rash, what are the common causes of rash in this child, and direction is a mnemonic I use where you don't miss anything. And when you think in a systematic or a step-by-step manner, you will never miss a diagnosis, you will be a safe doctor, and you will successfully pass the clinical exam. So if you would like to know about the group coaching program, which is going to launch next week, make sure you reach out, and I'm going to send the information, and I will be posting all the question scenarios from this recent exam as well. So make sure you reach out, and it's going to be a very cheaper price. The launch is going to happen, and that will be the last batch for this year. So if you want to get it for the cheapest price and not pay the high price next year when I launch the next batch, this is the best time to actually get into the program, and we will discuss everything. We will jump on Zoom meetings, we will do role plays. Where you have any problems, you ask me, we do role plays, you get access to my courses, and if you have any doubts, I will be there to help you, guide you. I passed all my 16 cases in my first attempt, and that's the reason many doctors fail, is because they don't have good mentors. They have people who are not working in the healthcare system teaching these doctors, and that's why many people are failing. So if you want a mentor who is an FRACGP educator, who writes the CPD programs, who passed all 16 cases, who has been teaching for AMC Clinical for more than 10 years, then you need to reach out and join this group coaching program, because it's going to change the way you look at the exam. You will be a good clinician and you will be successful. I wish you all the best, and I will see you in the next video.